Today we're going to discuss the endocrine system. And whenever you think of the word endocrine system, you're going to say to yourself, endocrine system doesn't deal with what's called ductless glands. So think of the endocrine system is going to have come out using what are called ductless glands. And those ductless glands are going to release what are called hormones. And hormones are going to equal a chemical messenger.
Well, go ahead and introduce yourself too.
Oh, this is Mark Van Cura. This is the endocrine system we're going to talk about today. At the top you're seeing Marco Rabazzo, a videographer, and he's the editor on these, and he may interject once in a while with some questions. And so let's begin by talking about the endocrine system. And you notice that I wrote endocrine system, and when we look at endocrine system, we're thinking it's ductless glands, therefore no duct. And whenever I think of a ductless gland, it has to produce something, and that's going to be a hormone. And I'm going to define a hormone as a chemical messenger. Now, if you go back and think about when you learned about bones, and when you learned about bones and we looked at what was called the cranial vault, and this was the cranial vault, so I've removed the calvaria, the skull cap off, and I look inside of there, and I notice that there's this bone called the sphenoid bone. So this bone, if this is anterior and this is posterior, this bone that forms the core axis of the cranial vault is actually the sphenoid bone. And the sphenoid bone has a process on it called the sella turcica. And if I take and look inside of that sella turcica, I'll notice that that sella turcica has inside of it a gland. And that gland that's sitting inside of there is the pituitary gland. And the pituitary gland is also called the hypophysis. And if we look at that pituitary gland, kind of a football-shaped gland sitting inside of that sella turcica, we're going to say, well, it's divided into two pieces. So this is actually looking at the pituitary gland that's sitting inside the sella turcica. And there's going to be the A for the anterior pituitary and the P for the posterior pituitary. That A, or anterior pituitary, has got another name for it, and that is going to be the adeno, A-D-E-N-O, hypophysis. Whenever you see that word A-D-E-N-O or adeno, that stands for glandular. So for example, if someone had an adenocarcinoma, that's a glandular tumor. So you may have a lung tumor, but it actually is a glandular tumor that probably metastasized from somewhere else. The P is going to stand for the posterior pituitary. And that's going to be the neurohypophysis. Okay, so now we get the big picture of where this is located. And we know there's something called the endocrine system. We also want to remember that there's also going to be something that we'll learn about in anatomy called versus what's called the exocrine. And although we're not dealing with that topic today, remember the exocrine is going to be the ducted glands. So I'll just say, as a quick example, Just think of a sweat gland or an oil gland. That's an exocrine gland. That's going to send its secretions directly inside of the lumen versus a ductless gland that's going to secrete a hormone. So now that we've got that, let's try and figure out this anterior pituitary and talk about the different hormones.
I was just going to ask, to list the different hormones.
Yeah, so if we take a look at the anterior pituitary, the question really is, what are the hormones that are produced? And remember, the anterior pituitary is the adeno or adenohypophysis. And so therefore, you're going to know that it's going to really produce 8 hormones, even though oftentimes books sometimes will say 7. The reason being is because there's one that's analogous to the other, that's a female versus a male. And so those hormones we'll start out with are TSH, which stands for thyroid stimulating. Remember, the thyroid is that shield-shaped gland in the anterior cervical region. So just think of how that's going to work. We've got another hormone that's going to be called MSH. That stands for melanocyte cell stimulating hormone. Just remember, melanocytes are black pigment cells. So we're always going to relate melanocytes to something you probably learned about when you talked about muscle, how that in a female, oftentimes the linea alba darkens during pregnancy. So always associate that with the linea alba of the running from the xiphoid process to the pubic symphysis, and also associate that with the areola of the nipple. And of course, that also darkens during pregnancy under the effects of melanocyte stimulating hormone. The next hormone we want to look at is the third one, and that's called LH, and that stands for luteinizing hormone. And a very strange spelling, luteinizing hormone. And of course, that works on the reproductive system. The luteinizing hormone is going to deal with the corpus luteum, which is the developing ovarian follicle. Of course, so therefore that LH, think of that as being a female hormone. So I'm just going to put this here to show that's a female hormone. Up here, I'm just going to realize that both men and women have TSH, so that's going to be a male and female. Remember, this is the male symbol, and this is the female symbol. MSH, even though we gave an example, linea alba and areola, it also is going to be responsible for the blackened pigments. So when you look inside of the eye, you know that the iris is a color to it, or the choroid layer. So therefore, that's also a male and a female hormone. So just think that this is going to be involved with that. Luteinizing hormone now is a female hormone, so strictly female. And there's a hormone that's analogous to it, which is going to be called ICSH. ICSH stands for interstitial cell stimulating hormone. The interstitial cells are the hormones inside of the testicle that actually produce testosterone. So we know that that's going to be a male hormone that's analogous to actually LH in the female. And when I'm saying what it does, so therefore it's going to cause the production of the male sex hormone, testosterone. The next hormone we want to know something about is going to be prolactin. Prolactin really is for milk production. So it causes the ducts of the breast of the female to actually produce milk. But you'll say to yourself, well, then that's just a female hormone. The answer is no. It's actually found also in males in very low levels. So we know that it is traditionally a female hormone, but also it's going to be found in males. It actually can be used to determine if a male has breast cancer. So even though we always think of breast cancer as something 1 in 8 women will develop probably by the age in their 50s, and that male breast cancer is on the rise, and a way to determine that would be do a prolactin level, and that would be elevated in a male that had male breast cancer. So it's something to never ignore, breast cancer in a male, because it's very deadly, because by the time it's usually caught, it's already metastasized. The next one is something called GH, and that stands for growth hormone. Growth hormone has effect really on all the cells of the body. So kind of think that GH is going to target all cells. It's going to be responsible for protein. Remember, CHON is the acronym for protein synthesis. And I always think of growth hormone as been kind of pushed quite rapidly over the last 10 years as the fountain of youth. And so therefore sometimes people take growth hormone and they take that to somehow theoretically reduce the effects of aging or reverse aging. The 7th hormone is going to be FSH, that's follicle stimulating. And of course, ovarian follicles, so that's a female hormone. And then the 8th hormone that we're going to have in here is going to be ACTH, and that's going to be adreno cortical trophic hormone. So that's going to work on the adrenal cortex. And remember, the adrenal cortex is sitting on top of the kidney. So if you just think of anatomy, here's your kidney, and that would be the pelvis of the kidney, and sitting over the top of it is the adrenal cortex. And remember, the adrenal cortex is the adrenal gland has got another name called the suprarenal gland, or above the kidney. So those are the 8 hormones of the anterior pituitary. That then leads us to the other part of the pituitary, which would be the posterior pituitary. And the posterior pituitary, remember, is going to be called the neurohypophysis. And what's significant about that is the posterior pituitary is only going to store and release hormones. It is not going to produce hormones. And therefore, it's going to produce 2 hormones, and those 2 hormones are going to be ADH, which is anti-diuretic hormone. Just think of ADH, anti-diuresis, stop urination. So therefore, if you stop urination, you'd say to yourself, how do I remember that? Well, let's see, if I just drank 10 beers, what did I notice about a half hour later? I had to urinate. Why did I have to urinate? Because when I drank beer, that's why it's the neurohypophysis. It blocked the release of anti-diuretic hormone, and therefore I had to urinate very quickly or dehydrate, which explains why you would get a hangover after drinking heavily from dehydration. The second hormone stored and released is going to be oxytocin. Remember, when you think of oxytocin, that's going to be for milk ejection. So that's going to be a female hormone. So ADH, that's going to be a female and a male. Oxytocin, that's going to be strictly a female hormone for milk ejection. Probably a lot of you are familiar with that term. You may have heard of Pitocin, something given to induce labor. So now we've got the anterior pituitary, we have the posterior pituitary. Let's just quickly draw an axis and see how this works and see how this goes together. So just remember, real quick anatomy lesson for you. If this is going to be your brain, you've got a structure sitting up here, and I'll put an H in it, and that's going to stand for the hypothalamus. Hypo means below. Thalamus is the relay center of the brain. And then running in a series of blood vessels and specialized neurons, below that and sitting inside that sella turcica is going to be the pituitary gland. Pituitary gland, remember, is going to have an anterior and a posterior. And then finally, this darkened line here, we're going to remember, is a strange term that's very lengthy in the way you say it. It's called the hypothalamo-pituitary portal system. So hypo, which means below, thalamo, which is a relay station of the brain, pituitary, portal, system. So just remember that's going to sometimes abbreviate the HPPS, hypothalamo pituitary portal system. And that is how we're going to take these hormones and start out with some releasing hormones by the hypothalamus. So remember, hypothalamus is going to produce releasing hormones. It's going to produce releasing and stimulating hormones. But those are just going to either cause the release or stimulation of the pituitary gland. And they're going to, so that hypothalamus up here is going to release or produce some hormones. It's going to send them to either the anterior, posterior pituitary, and then they'll all, remember, those will always go through the systemic circulation.
Could you move your notes to your right a little bit?
So
the other way.
When I look at my systemic circulation, those hormones are literally chemical messengers. So the only place they can literally work is where there's receptors. So that's why those are going to go to what are called target organs. So that's the big picture of the endocrine system. So I guess the next thing would be is you'd say, well, how do I remember this? How do I relate this to someone? And I think of it maybe an example.
Examples of the feedback, the endocrine feedback loop.
Right. So feedback, remember, is the terminology used is how I control something using what's called a negative or positive feedback loop. And I think the way to really understand this is put this in the relationship to two patients. So the first patient I'm going to call this patient number 1. And I'm going to call him the couch potato. Couch potato is going to be a 50-year-old male, and he's going to be overweight, and he's going to have cold, clammy skin, and he's going to be tired and sleepy all the time, and I really have no energy levels whatsoever. And therefore, we're going to try and diagnose him what's wrong with him. And so all we have to do is draw this person. So here's this man's head again. Sitting up here is the H. Remember, that's the hypothalamus. So that hypothalamus is going to produce something called TRH, thyroid releasing hormone. Okay? That thyroid releasing hormone is going to pass through that hypothalamo pituitary portal system. Remember, hypothalamo pituitary portal system, which is a series of blood vessels and specialized neurons. And because we're talking about the couch potato here, we're then going to go to the pituitary gland. I'm going to put a P in there. So therefore, that's the pituitary. And when I think of these signs and symptoms, the one thing that comes to mind immediately to me is that this pituitary gland means that this person probably has a problem with their thyroid gland. And therefore, the pituitary gland is going to produce something called TSH, or thyroid stimulating hormone. Now, if I kind of go down to here, and here's the rest of this man's body, he's just a stick man. But sitting here is that shield-shaped gland in his neck called the thyroid gland. And the thyroid gland, the shield-shaped gland, is going to be the TO, or the target organ. Well, let's see. If I've got these signs or symptoms, says to me that I have a underactive, this is going to lead to what I would say, my diagnosis, or DX. So you'll see it the old way to abbreviate was your DX, or diagnosis, was going to be a underperforming thyroid gland. Well, let's see what happened to it. Well, when I looked at that couch potato and examined him, I noticed that he had an enlarged neck. So let's say a sign or a symptom after a physical diagnosis, a sign was going to be a swelling of the neck. Well, the swelling of the neck tells me that that thyroid gland has enlarged. So the swelling was hypertrophy of the thyroid. How did that happen? Well, let's see. The thyroid gland was underperforming. So therefore, remember, the thyroid gland is going to produce something called thyroxine. So it produces what are called T3, T4, and that is thyroxine. So the one you want to remember for this one is thyroxine. You may know people that have underperforming thyroids and they take levothyroxine, and therefore that's one of the drugs. The generic equivalent is not the same. So this person has decreased thyroxine levels. So just remember, my thyroid gland in this example means he equals decreased T, decreased thyroxine. That goes through the feedback loop through the entire systemic circuit and goes back to the hypothalamus, because remember, all the blood that starts one place in the heart goes all the way back to the heart. That's going to cause the hypothalamus to increase thyroid releasing hormone. So that's going to cause an increase in TRH. That thyroid releasing hormone is going to go through the hypothalamic pituitary system to the pituitary gland. That's going to cause an increase in TSH. And I increase my thyroid stimulating hormone. That's going to go right back to the target organ, because remember, this is a complete loop that's going to go back into the wherever there's receptors, and therefore that's going to cause that thyroid gland to increase in size, and therefore that's going to lead to a goiter, which is going to be that enlarged thyroid gland. So again, that's patient number 1. That's a great way to remember the endocrine system. And now I'm going to give you a second example, and that's patient number 2. And if you think of these 2 patients, whenever you're working on the endocrine system, you'll see that you can pretty much analyze any one endocrine problem just by remembering these 2 patients. This is going to be called the woman in menopause. Well, the same thing, we're thinking of a woman in menopause. Let's think of the signs or symptoms. She's going to be kind of crabby, probably mood swings. She may complain of hot flashes. She may have a bone density test called a DEXA scan. They're going to say, hey Mary, you've got osteoporosis, which is also called osteopenia. Remember, that's another name for decreased bone density. Well, now we've got to figure out why she has these signs or symptoms. What's the reason? Well, we're going to draw Mary. So we're just going to draw her. Here's her head again. She's got an H, or a hypothalamus. So that's your H, your hypothalamus. The hypothalamus is going to produce something called FSH, follicle stimulating hormone, stimulating the ovarian follicles and therefore stimulating the production of estrogen. So now we're going to then draw this little line in here again. That's going to show me that hypothalamo-pituitary portal system. That hypothalamo-pituitary portal system is going to go to the posterior or the anterior pituitary. So now this is my pituitary gland again. Remember, the pituitary gland, since this is the hypothalamic pituitary, so this is going to produce GnRH. Let me just fix that. This hypothalamus is going to produce GnRH, gonadotrophic releasing hormone. Let me just straighten that out. So the hypothalamus, remember, produces these releasing hormones. So GnRH is going to stand for gonadotrophic releasing hormone, gonadotrophic. So let me just write it down for you. Gonadotrophic releasing hormone. And then the pituitary gland is going to produce, well, that's going to produce FSH, follicle stimulating hormone. So if we draw the rest of Mary's body in, we're going to put right here is her ovary. So here's her ovary. So her ovary in this is going to be the TO, or the target organ. Now we want to think about, just as we talked about the couch potato, what's going to be our diagnosis? And our diagnosis on her is that she's got an underproducing ovary. So she has an underproducing ovary. Maybe she went through menopause. Maybe she started having her menstrual cycles very, very early. And so therefore, let's see what's going to happen to her. Well, if she's got this, she's got decreased what? Well, she's got decreased estrogen. Because remember, the ovary is going to produce estrogen. That's your female sex hormone. The decreased estrogen is going to then go through that feedback loop through the systemic circuit back to the hypothalamus. The hypothalamus is going to say, I've got to increase GnRH, so it's going to increase gonadotrophic releasing hormone, pass through the hypothalamic pituitary portal system to the anterior pituitary. It's going to tell the anterior pituitary to increase FSH, follicle stimulating hormone. Follicle stimulating hormone is going to pass through the systemic circuit to the ovary, and say, ovary, you need to produce more estrogen. The problem is the ovary can no longer produce more estrogen. So therefore, as a result of that, she develops these signs and symptoms of mood swings, hot flashes, osteoporosis, and osteopenia, and therefore the underproducing ovary is leaving her with the signs and symptoms above, and therefore that's going to cause an increase in the size of the ovary. So when she goes for an ultrasound, you may notice that she's got hypertrophy of the ovary, one or both. Remember, hypertrophy is an increase in cell size, but not cell number. So that ovary is going to increase in size and keep on bombarding itself because it's trying to make more estrogen, but the ovarian follicles can't. And until I do something, at the end of the day, she's going to keep on having these problems that she's developed up here. And the only way to break that cycle in this person would be to give exogenous estrogen. And that would be in the form of either birth control pills, or you could give her Premarin. Premarin, of course, got its name from pregnant mare urine, which is full of estrogen, and therefore you'd break that loop. But of course, there's so many different studies that have said that yes, we should do what's called HRT, so that this right here, another name for this, is actually HRT, or hormone replacement therapy. So just to backtrack and make sure you understand this, if we looked at the first gentleman that was the couch potato, in the couch potato, we saw that he had the same issue, except he had all these signs or symptoms. How would we break that? Well, the only way to break that loop going back on him would be to give him exogenous thyroxine. If I gave him exogenous thyroxine, it breaks the loop. It's therefore going to stop the TRH. It's going to stop the increase of TSH. And now the question is, will I have to remove the thyroid gland, or will I have to somehow ablate it? Same with this person. Same thing we're doing. We've got a feedback loop, and once we got through the feedback loop, we saw we could only break that feedback loop by introducing some exogenous hormone into it. And so that really explains what I would call the big picture of the endocrine system. So have a great day, and we'll carry on to the next topic.